Dr. Paul here. We've got a young baby who's had a lot of feeding issues and some issues with just the tongue and latch. We'll go take a look. Hello. Hey, how you guys doing? So you guys have been through it, haven't you?
You actually diagnosed her with the tongue tie, and we were referred to Dr. Gahary, who corrected tongue tie and lip tie.
Okay, so the upper lip tie?
Yeah.
And then under the tongue?
Exactly.
Okay, with the laser under the tongue?
Yes.
Yeah,
yes.
okay.
So it actually healed over a little too quickly, so he corrected it again.
Oh, wow, that's right. So you had to go get that lasered again.
Right.
And then massages afterwards, right?
Yeah, so we had to be really aggressive with the stretches.
Back and forth.
Yeah.
Okay.
Yeah. Stretches to keep it from healing, because the mouth heals so fast, right?
Right.
And then he gave us lots of PT exercises to do thereafter with the pacifier, and then she's had multiple lactation visits in the home and cranial sacral therapy to follow too.
So when I walked in just a little while ago, Dad was here and he had to leave for work, but their frustration was that you have to go back to work, right? And this little one won't take a bottle.
No, absolutely.
Won't take a pacifier, won't take a bottle, and we're thinking, with all that, surgery and massage, I'm thinking maybe she's like fearful of anything, getting into her mouth. So I'm going to try to see if I can get her to relax and take a finger. Let me wash my hands here. This is just a little joke for the YouTube viewers, because they're always going, "Where's your gloves?" But anyway, I find that for what we're doing here, it helps to have flesh, just because this little one accepts the breast, and so I don't want to introduce a plastic thing. Let me borrow her if I may. Okie doke. Here we go.
So she used to readily take the finger. When you came to visit us in the hospital, she could suck the skin off your finger.
Yep.
But then I almost wonder if I've overdone it with all the PT and getting her tongue moving.
Yep. And so what you were doing, you were telling me with PT, was moving the tongue back and forth?
Right. So what Dr. Gahary and the lactation consultant that he recommended had said was that her tongue was very weak and needed to be retrained after the tongue tie correction. So we had been running the pacifier along her gum line to get her to move the tongue back and forth and strengthen. And now she wants to thrust the pinky, the pacifier, anything but the breast out of the mouth with her tongue.
So I notice, hi baby, it's okay. So one of the things when you're dealing with babies and feeding is not forcing the issue. So, oh, it's okay, baby, it's okay, it's okay. So we're just gonna touch the lips, get used to that. Okay, you're gonna be hard on me, aren't you? Okay, baby. Okay, baby. I know. I know it's hard, huh? You had all that massage done and it was hard. I know.
What does massage mean when you guys say that?
Basically stretching the incision that they made under the tongue. You have to stretch it really good and then kind of massage it so that it doesn't heal back into the
Wrong way.
wrong position. Yeah.
She's tough.
Mm-hmm.
So if this was a bottle, I might be dripping a drop or two of breast milk in.
Mm-hmm.
And it might be like, oh, that's okay. Yeah, you're like going, you're not my daddy.
Are you getting any latch?
Very, very little. Yeah, I think she definitely has that sort of, oh no, not the pain. you
Yeah.
know? Okay, baby. Shh, 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 shh. Yeah, and you know that the breast never hurt you, huh?
How can she tell? Texture?
Yeah, it feels different. The massage was the finger,
Oh,
and
God.
so the finger and the pacifier feels similar to a finger, probably. So she's like, oh no, not that.
It's amazing that they can do that.
She's got PTSD from massage.
I think she does.
Yeah, I think she does.
She
When
gets
I-
fussy even when you start to hold her in that
In that
position.
position.
That you massage her in, because you have to hold the baby in your lap with her head,
Oh,
you know,
interesting.
facing you, and so she gets really fussy if she even thinks you're putting her in that position.
Wow. So this, folks, is an aspect about tongue tie and tongue tie revision that we haven't really looked at, and that is, you know, the post tongue tie revision, post laser surgery involves this massage that's obviously painful. And what are the long-term effects of that? Obviously, the long-term effects of successful breastfeeding are huge, so I think it's still likely worth it.
Definitely.
But this is a side effect that's, you know, it's like, Now, what I was trying to show Dad, because he's going to have to try to feed this baby when Mom goes to work, is not forcing the issue. So she was resisting my finger, and now she isn't. The crying is outside the room, not here. And so my hope was, with a bottle that would slowly drip, we would get eventually acceptance.
It's like a principle of life.
So initially, you recall, I wasn't able to get her to even let me touch her lips. I now have about a centimeter of my pinky in her mouth, and she's accepting it. She's not sucking yet, although she probably will, especially if I had some breast milk dripping out of this. If this were a bottle and I had breast milk dripping out of the nipple, I bet she would suck. So right now, her tongue is in the right place under my finger,
Okay.
and I bet. So the other trick you can do to get a baby to start sucking is to pretend to pull the source of the milk away. And so when I try to pull my finger out, I'm not quite getting that sort of, no, don't let it go, you know what I mean? But, of course, at least her tongue's in the right place.
Right.
Before, when I was trying, her tongue would go to either side. Sort of a side effect of that. Now there's her tongue coming out on the side, which is, we figured out from talking earlier, it was probably left over from that massage.
I think so.
Yeah, but she's accepting, you can see she's accepting a fair amount of my finger.
That's more progress than we've made.
In fact, I now have my finger in the back of her throat, and she's accepted it. She's not gagging.
That's good.
If
She
there was,
usually does.
If there was milk in this finger, if this was a bottle, it'd be dripping down her throat and she'd be sucking. And sometimes I'll do a little wiggle, kind of rotating movement, just gently wiggle to see if I can get her to start sucking. And she is making slight, very slight suck movements. I'm not gonna force her to do anything because that's when babies will start. Okay, so she just. Hey, oh, shh. Look at that. We got a couple sucks.
Yeah.
There you
There
go,
she
baby. There
goes.
she goes. She's sucking.
Oh my gosh, it's a miracle.
She would have just sucked down a whole bunch right there.
Yeah.
We got about 5, 6 really good sucks. There, she's going for it.
Awesome.
Okay, so that took a little while, but she's now holding on to me, and when I try to pull it out, she's not letting me out now.
That's great.
And then she's sucking again.
Oh, I wish I had a bottle with me.
I could make it work.
Yeah.
Now her tongue goes sideways again. There, now she's sucking. Look at her. See that?
Awesome.
She's just going for it. How long has it been since you've been able to get her to do that?
It was definitely before the tongue tie revision,
Yeah.
so she must have only been a couple weeks old.
Yeah. So she's going for it. She's sucking now. And if I had a bottle, I could just replace my finger with a bottle. Or I would have done the same thing that I just did with my finger, but with a bottle. And I'm going to get her to take it by not threatening her.
Okay.
You know, she's got to relearn that she's not going to have pain anymore. You know, there's not going to be something coming at her that causes pain. And obviously, you know, she's content. Look at that baby face. Let's get a close-up of happy baby face sleeping with, in this case, it would have been a bottle. All right.
Very good.
Well, there you go, folks. Thanks for watching this. Thanks for letting us demonstrate, because this is
Absolutely.
an unusually
Thank
rare event to have had tongue revision and physical therapy, and then now sort of a PTSD to the feeding. But we can get through this. All right. I'm Dr. Paul. Thanks for watching. Goodbye, little baby. Bye-bye.
I'm going to have Kyle watching that video as soon as you post it.
Well, that's the other thing. Then he can go back to it.
Yes.
You know, when he gets
Exactly.
frustrated, he can just see. You gotta just be patient.